Hey, my name is Ammar Ahmed. I'm a second year PA student and I'm going to be doing the pelvic exam and pap smear on you today. So just a little bit of information about the exam. I'm sure you've had it in the past, but if you hadn't, we're going to use the speculum and go in, make sure your cervix is okay, there's no signs of infection or inflammation. Use the pap smear to collect any samples to test it, making sure there's no, STIs or any atypical, cancerous cells. We're going to start the exam off by having you in the lithotomy position, bringing your butt back to the end of the chair. So just going to keep you come back until I feel right there, perfect. And so we're going to start off and just kind of inspect the surrounding areas like the labia, making sure there's no signs of infection or any, nodules that shouldn't be there. We're gonna now move to the palpation. I'm just gonna palpate the labia, kind of palpate the skiing glands, making sure there's no abnormalities, any genitalia, the meibomian glands, all that. Let me know if there's any pain or tenderness with that. And there normally should not be unless there's any signs of inflammation or infection. So now we're gonna continue on to the procedure itself. What I'm going to do is get the speculum ready. I would have a light source in there to be able to visualize it better. Insert this in a plastic bag or whatever I need to do to, get the KY jelly or water if needed around the area to, cause less discomfort for the patient itself. So now, inform the patient, I'm going to let you know that it's going to be a little bit pain. You can feel a little bit pressure. Go in at a vertical angle and kind of go in slowly and twist. And the cervix is usually a little bit lower, so I'm going to angle it down and ask her if are you feeling any pain or tenderness? She shouldn't be, just a little bit of pressure. And kind of snap it open until I can visualize the cervix and the os. And so now I can see it. So now I'm going to insert the brush to collect samples, which we are going to test, just to see there's no signs of any, like I mentioned earlier, any atypical growth or any STIs, any no BV, no candidiasis, no yeast infection. So do a couple of 180 spins on it, collect the sample good, put it in a container, get a little bit more samples, pull it out. And then, so now I'm going to release the speculum, pull out a little bit, and then slowly get it gentle and pull out. So that's going to complete the speculum part of the exam. Now what we're going to do is look at it and then do the bimanual. So I'm going to get some KY jelly on my fingers and I will stand up for this procedure. So what we're going to do is insert your fingers into the vagina and let the patient know that they're going to feel a little bit of pressure and tenderness. So what I'm going to do is feeling the uterus, pressing on the lower abdominal area, making sure she doesn't have any, any cervical os tenderness or any of that. And then I'm going to move my hand to the left, feeling for her left ovaries. Usually you're not going to be able to feel anything, but if you do, it's not really that concerning unless she has pain along the area. And then move to the right, same way, no pain or tenderness. Really couldn't feel them that well. That's not a big deal. And then I'm gonna slowly remove my fingers. So now what we're gonna do is send the sample off for testing. Usually you can get some of the results today, such as the BV if you have any under the slides, or if needed we can we get the sample back later on for the pap smear. Just a general reminder, we're done with the exam. Just to keep up with your yearly pap smears, depending on if you find any growth. If not, 3 years or 5 years if you get the HPV testing done. Other than that, if you have any discharge or any signs of concerns, just let us know. Come make an appointment, and you can come in. We can take care of you. Okay. And that is the pap smear and the bowel manual exam.